Okay, so let's get started, shall we? I'm Dr. Shelley, and as I stated, this video is all about how you need to go about studying for the Ngn Nclex exam. It has been out a while now. We definitely know what to expect, and whether you're preparing to take your LPN NCLEX or your RN NCLEX or your HESI exit exam or your ATI exit exam, this video is for you to just help guide you as to how to study, how to get the most bang out of the buck for your dollar on maybe some resources we can help you with or resources other people can help you with, and just different things that maybe you thought you heard about as being a wonderful resource, but you really didn't know. So let's get started, okay? Now, so Dr. Shelley represents HETV, Health Education Television, and my company in Cleveland, Ohio, which is Shelley's Nursing Review. Don't forget what HETV is. HETV stands for Health Education Television. It is the only one of its kind. In other words, this HETV YouTube channel that you're going to be able to use gives you well over 500 videos for free. I put my entire nursing school on the NCLEX for the NCLEX exam preparation. I put my entire nursing school on YouTube. Didn't charge a penny. You see what I'm saying? I mean, come on now. Who does that? No one. Why don't you do the work for me and tell me if I'm right? I promise you, research it. No one has done that. So I need you to know that maybe you don't have to spend a lot of resources, but what you spend, you want to make sure that's what you need. So let's look first at how to study. The best way to study for the NGN test plan or the Ngn Nclex test is to just make sure you know that this is based on an Ngn test plan. Many people don't really do much research on the test itself, and they're kind of doomed when they go in to find out there's all these different sections, and when they get their CPR report, they're like, what are these sections? So remember, just to quickly call out some of the sections on the test plan, you have your management of care, which if you're an LPN, that will be called coordination of care. But the RN exam is management of care. This is all your ethical, legal, your advanced directives, your DNR, your impaired nursing, your workplace conflict, your SBAR. It's all the management, right? It's not direct hands-on patient care. It's also prioritization and delegation. Then you have your safety and infectious diseases, and you know yourself that you have to know what goes in airborne or droplet or contact precautions. And of course, everybody gets standard. And you have to know the individual infections like tuberculosis and Shigella and C. diff and all of those things, right? So that's your safety and infectious diseases. Then you have to know health promotion and maintenance. And I just want to tell you, this is a really big area. Health promotion and maintenance is your maternity, your pediatrics, your growth and development, your geriatrics or elderly patients, changes to expect, not abnormalities, just changes to expect as the patient gets older. You have to know your cancer screenings and your vaccines. That's under health promotion and maintenance. And of course, there's psych. Now you have to understand why the Ngn Nclex test plan really loves psych. It's because every single one of us, no matter if we work in the neonatal intensive care unit or the medical intensive care unit or in maternity or in ortho, or perhaps we like endo, like where I am right now, or any med-surg unit across the field, across the water, across the nation and internationally, we're gonna get cray-cray. Sometimes we get cray-cray on steroids, like, oh God, code violet. So you know that the test is gonna give you questions on psych, right? Because cray-cray is all around us. You might be cray-cray. Okay, now then you have your basic care and comfort, and I have to get you right there with me, okay? Basic care and comfort is the category that you fail most often, and it's tied with reduction of risk. These two are very much overlapping. You have your reduction of risk, which is 5,000 different procedures, and your basic care, which is all your ADLs. And, you know, when it comes to basic care, you kind of don't get this, you're not very clear on this category because you tend to have gone to schools where they taught you very acute diseases and how to give them a medication for it and how to put in a Foley catheter and all that stuff. Well, you know what? Basic care and comfort is basic care and comfort. So let's give you examples. If I told you I was constipated and you said, let me get you a stool softener, you would fail basic care and comfort. You should have gave me the dietary recommendations like high fiber diet, push fluids, and then you should have given me something about range of motion and movement, like move more, right? If I tell you I have heartburn and you say, oh, well, let me get you an antacid, time out, you fucked up. Yeah, you were supposed to tell me don't go to bed right after I eat, make sure I avoid spicy fried foods, don't wear tight clothing, and try losing some weight. See what I'm saying? It's basic. Yeah, it's diets, it's positioning, it's hygiene, it's crutches, casts, and walkers, it's activities, a range of motion, it is your teaching, all your teaching, like anything you would teach would be under basic care and comfort. Taking care of the patient at a basic level that did not require drugs unless it's over-the-counter pain modalities. Warm compresses, hot compresses, cold compresses, ice packs, sitz baths, those are all basic care and comfort. Okay, so you know, sometimes we don't learn that basic stuff. We're too way up here trying to pass that test in cardiology. Yeah, so that's the problem. Now, if you look over here, we have pharmacology. I don't have to go on and on. You know what pharmacology is. Sometimes it's not enough to know that pharmacology is medication. Sometimes you got to be real in tune with medication administration. What do you do if you have a sub-Q injection and the BMI of the patient is over 25? Yeah, well, guess what? You got to go to 90-degree angle instead of 45. How do you insert an IV when you want to start IV fluids on a patient? You got to go at a 15-degree angle. And what kind of injection is a TB skin test anyway? Intradermal. You see what I'm saying? It's not enough to study medications. You must know medication administration, which is in my materials, right? So, and then if you look at the reduction of risk, as I stated, this is a situation where everything, every single thing you need to know is basically a procedure. So eye drops, ear drops, Foleys, NGs, EKGs, EMGs, EEGs, TEEs, all of these procedures, CAT scans, MRIs, Glasgow scale, log rolling, there's a ton and it's a lot. And so don't worry, we have a packet for that, right? So this, and I gotta say it, I gotta stress it, this is a high area of failure. And I don't want you to fail, so I need you to know, maybe write it down, that basic care and comfort and reduction of risk are high areas of failure. Because then you're gonna study those the most. All right, now, physiologic adaptation is confusing to most, but if I say pathophysiology, you kind of know what I mean. In other words, physiologic adaptation is all about why did a disease occur, what are the signs and symptoms, what caused it, what's my risk factors for it, and a lot of times the student gets those terms confused. They do them right in class. I'll say, what's a risk factor for what's a risk factor for, let's give you one, skin cancer. And you might say smoking. That's true. Now, did it cause skin cancer? No, but you kind of get them confused. I might ask you, what are risk factors for colon cancer? And you tell me, oh, I know, black tarry stools. No, you don't know. That was not a risk factor. That was a sign and symptom. It happens in class all the time. Physiologic adaptation is your ability to dissect the disease, pull it apart, and tell me everything about it. Okay, I hope I made myself clear. Now, How can I help you? Well, for one thing, I can tell you that while these are parts of the test plan, management of care is the highest, almost 20% of your test. But then when you come over here, you also have 15% of your test being pharmacology, and that whole physiologic adaptation is about 14%. Now, ironically, you would think, oh, well, then I need to focus on those parts the most. No. There's only 9% focus on basic care and comfort, but you need to focus on it the most because you fail it the most. And then your reduction of risk is 12%, but you fail it a lot. And so don't go by the percents, go by what I can honestly tell you I see with my own eyes, and I talk to you with my own mouth, and I listen to you with my own ears, and you tell me how you didn't know basic care and comfort and reduction of risk, okay? So in addition to that, the last part of the test plan that I always go over really quickly, but I don't want to really emphasize, is the clinical judgment piece. Yeah, this whole thing, like if you get a CPR report and it says clinical judgment, everything below it was your case studies. It's the one area where students get aboves. Lots of people get belows all up in here, but the only time I see aboves half the time is right in here. And so what do you have? You've got the different components of clinical judgment. There's 6. We know there's at least 3 case studies on any 85 question test. Of course, the Ngn Nclex goes anywhere from 85 to 150 questions. You know that. You could fail with 85, pass with 85, fail with 150, pass with 150. Anywhere in between, you could pass with 112, fail with 112. You could take 120 questions and pass, or 120 some questions and fail. Anywhere in between that, right? But we know what we say when you take a test and you get 85 questions and you failed. You at least had 3 big case studies, and case studies are not to be concerned about. No, you don't screw up case studies. You guys do really well on case studies, so stop studying so much about the case studies. But what I'm trying to tell you is we know when you take this test that you're gonna get, if you failed that test in 85 questions, you knew nothing and you killed everybody. CPR cannot bring them back. Ooh, that's ugly, but I have to be honest with you so that you understand if you failed in 85 questions, you need a lot of help. What about those belows? Well, if you got more than 2 belows on your test, like 4, 5, 6 belows, you need a lot of help. If you failed in 150 questions, you barely failed, you might not need as much help. What if you failed in 150 questions, got all near passing and aboves, no belows at all? Wow, that's kind of cool. If you got all near passing and no aboves, couple of belows, you need a lot of help. Near passing is not you almost passed. Let me just straighten you out right there. So let's talk about what near passing means. Because, you know, below passing means pretty much you didn't know anything in that category. Above passing means you pretty much knew everything in that category. The near passing is when they gave you simple questions like what causes cirrhosis and you answered alcohol. You got it right, 2 points in the basket. Now let's get a little bit more difficult. Let's ask you what causes ascites in the cirrhosis patient, and you couldn't tell me, and you never mentioned, and you never clicked low albumin levels and portal hypertension. Well, you get a near passing because you knew the basics, but once we made it more difficult for you, you were like, bye-bye, Felicia. You didn't understand or know the answer. So that's how you read your CPR report. Now, if you've never taken a test, I'm hooking you up with how to never fail, right? Now, so how can I personally help you? That's what you ask the most. You send me your text message to 216-410-0936. You send me that text message and you're like, okay. And then you wait. You don't ask me anything. You just send me the text message. I failed NCLEX. Give me a long story about how, and then you just be like, I know she's gonna help me. Well, you're right. I am going to help you. I'm going to help you figure out how I can best help you because we have so many options. We have, and this is the latest update because I want you to know some things have changed at Shelley's Nursing Review and HETV, right? I just need you to know what it is. So we have the NGN self-study. That is where you get all of my packets, I guess there's like 30 plus packets on every subject. And if you go to HETV, under the playlist, you will see it's divided by subjects. So cardio, respiratory, GI, immunology, management of care, basic care and comfort, reduction of risk, neuro, cancer, diabetes, endocrine. It's got every single one of those subjects, but it's a playlist. If you click on it, you will get a group of videos inside of that playlist. Well, we have the actual packets that go with the playlist. So, for example, if you just look at these, you can see we have cardio, respiratory, chronic respiratory, acid-base, renal, and all I did was grab a handful off the table. But we have one for every subject. So, you know, there's at least 30, 40 packets. That whole package called self-study is ideal for someone who cannot make it to Cleveland, someone who really works a lot, someone who doesn't feel they really need a whole course, like maybe you were the one that failed in 150 questions, maybe you only got a couple of belows, or worse comes to worse, maybe you did do really bad, maybe you do live really far, maybe that's the only thing you can do is self-study. We get it, so we have it. And so what it's geared to do is you purchase the self-study for now, because the New Year's coming, it's $3.99. You use the PayHip link at the top of my HETV page. Just click on it. It'll take you there to help you purchase this program. You get 2 free consultations, not free, but complimentary. You paid for it. 2 complimentary consultations with me to help you figure it all out. And then also you get any updates we have for free, which we always have updates. And then also you get to use this with the over 500 HETV videos. Now, we tell you if you're gonna buy the comprehensive self-study, you're gonna need the UWorld RN to go with it. Even if you're an LPN, please hear me clearly. I know what you need to pass this test, and you need the UWorld RN, okay? Now, there's another program called the BOOTCAMPS. I am delighted to say we just got finished with one of our boot camps. It was so fun. I had someone fly in 19 hours from Saudi Arabia, you guys. My heart just was so, I don't know, filled with joy that someone would come 19 hours to Cleveland from Saudi Arabia. Like, I took a picture with her. I was tickled. And so she felt really good when she left and got to go 19 hours back home. And so it doesn't matter where you live. We do have discounted hotel stays. You're only here 3 days and then you're back home. We suggest that for most people. If you failed 6 times, 20 times, if you graduated 10 years ago, 20 years ago, it doesn't matter. If you just graduated from Ohio right here with me, it doesn't matter. This is the bang for the buck. And what's funny is even though I don't ever discount the self-study program, we give you half off of boot camps all the time. You do have to listen because like I just pop up a quiz on this channel and I say, come on, you guys comment. Someone just passed. And so I give a shout out to my girl. She passed. She gets half off of whatever except the self-study. So you could get this $399 3-day review with all your little pink packets, all 8 of them. You could get that bad boy for $200 any given day because I'm always giving half off. I like to give discounts, okay? Now, this is a 3-day NCLEX review right here in Cleveland. No, Zoom is not available. It's 8 pink packets. We have dates in October, November, and January coming up. So, you know. Or you could be very, very, very budget friendly. You might need something a lot less, shall we say, costly, but you still want to know how do you at least understand this NGN test plan? Well, there's the pink packets. Almost everybody knows the study guide, which is the Oh My God packet. And so that is my #1 seller. But that comes in a group of 8, and you get the management of care. This is always popular. And remember, it's 20% of your test. And then the one you fail the most, which is your reduction of risk, right? Remember, we said that's a big one. And remember, too, everyone, that the reduction of risk packet has almost all of your basic care and comfort in it. This is no fun either if you don't know your precautions. So we have our infectious disease, transmission-based precautions, contact, droplet, airborne, standard, protective, you know. So we have that in your 8 packets. We have your EKGs and LPNs. I got a news flash for you. You got EKGs on your test. And then, of course, we focus a lot on pharmacology, medication categories, that's my favorite one, I just updated that, and psych meds. Now, so all 8 of those are $88. If you go through the PayHip link, it's going to cost you more. Always hit me up at 216-410-0936 for the deals, and that is a deal. It will definitely go up next year, but for now, it's a deal. So get it now, right? That's your 8 for 88. Now, maybe you don't want all 8. Maybe you just need 7. 7 for 77. Maybe 6 is your favorite number. 6 for 66. So whatever, all right? Delayed, not denied. Ooh, this is specific for people in Ohio, unless you want to travel from abroad and come here and stay with a friend, or in some of the housing we're about to purchase for students. We are, yes, going to have affordable housing for students who actually do want to come and live here for the duration of the time that it takes you to learn how to pass this test. Delayed, not denied, is for that very high risk student who failed more than 3 times, who graduated more than 2 years ago, who kept taking the test and doesn't know where to go from here, who went to a crappy school, especially you poor people in Florida. Florida schools are terrible. I've never seen such craziness in all my life. Like, I'm so upset about Florida schools. For real, I'm serious. Like, don't go to Florida schools, okay? Get out of Florida. There's an FBI investigation on some of the programs. Some of the other states don't want to give people coming out of Florida their license. Get the fuck out of Florida. Plus, they're, you know, they got a little racism thing going on. Hello, I said it. Yeah, I said it. Now what? Anyway. Where was I? Oh, yeah. Delayed, not denied. So if you failed your test several times, if you're an international student who came from another country trying to pass the test here, if you graduated years ago, if you've been through a lot, forgot a lot, had a stroke, whatever, I'm your girl. Delayed, not denied is 5 whole months. Do you need all 5 months? Probably not, but I give them to you if you need them. So you get up to 5 months of instruction right here in Cleveland, Ohio. The other last program I have is the traditional Ngn Nclex, and that's for the brand new grad. Now, the delayed, not denied is almost $1,000. The traditional, I just graduated. I'm not going to wait. If I wait more than 30 days, I'm going to go up in price. I'm signing up for Shelly right away. I can't wait to get this done, and I want to take my test right away. Yeah, smart. 30 days. Within 30 days of graduation, you get your butt in here, and it's $589. Now, every program I have, don't get it twisted, every program I have has to be utilized with UWorld RN. And no, I don't have a discount code. And no, I don't own it. And no, I don't get no fucking kickbacks. I just know the shit is the bomb. They got the videos. Those videos aren't as exciting as mine, but they are there and they do help. Now, I would go to, HETV and look at whatever first, go to their videos, look at those. They also have an assessment test. When you get your UROD, you're gonna need 90 days. When you get it, you have to take the assessment test before you do anything else. Don't break it up in pieces. You got to get it done right away. It'll say, I think, RN assessment. Get that done when you first get it to see where you got to go. Once you get done with that, don't take any more assessment tests until 1 week before your actual NCLEX. Once you take that assessment exam the week before your NCLEX, if you don't get a score of 75 or 85 if you're RN, 75 if you're LPN, again, if you don't get on your assessment score a 75 for LPN and 85 for RN, scrap that date, choose another one. What happens if your ATT is about to expire? Like it's about to be expired. Never waste money. Go take it anyway. Now, I love you. I hope this helped. Remember to text me for whatever you need. I can help you figure it out. It's called a consult. We still do consults for $35. That will go way up in January because I can't keep up with all these consults and I don't know how to help you guys if I'm not available. So again, right now, consults are still $35 for me to help you decide what you need, but you can't get a consult without an Oh My God packet. So together, the Oh My God by itself is $35. The consult is $35 together. That's $70. If that's what you need, that's what you get, okay? All right, deuces. Hope that helps.